Hello, viewers, and welcome to another webinar by MHT. So, today we'll be discussing a very interesting topic about understanding sexual disorders. Today, to help about this, we have Dr. Lokesh Babu, a very well experienced professional, especially in the field of marital and sexual counseling. So, thank you so much for joining us today, Doctor.
Thank you, Antina. Nice to be collaborating with you and educate the mass.
Yes, it's so great to have you. So, starting out with, let's talk about, I think, something that people will find the most interesting. Let's bust those myths about sex and sexual disorders.
Okay.
So, what would you classify as the most common misconceptions that people have about sex nowadays?
Well, first and foremost thing is sex is a big taboo. The word sex actually brings only the copulation into the minds of the people. Sex is not intercourse. Okay. So that is the reason why there is a huge stigma when parents don't want to talk about sex with the children. The schools don't want to talk about sex with the about sex to the students. And when the bill was placed in the government recently to introduce sex education at the 10th standard, there was a lot of the ritualistic or whatever prejudiced ideas took over it, and they couldn't place, because once anybody says the word sex, it only like means for everybody about intercourse. It is but sex is not the intercourse. Sex is more than that. Sex is just like being completely lost yourself in some thought. Basically, the word passion is more a substitute than a sex actually. So it's one of the, like, mental health. Sex is also a big taboo, and people don't even know where to go when they have a sexual problem. That is the And they go to all these jadi booty fellows and lose a lot of money, and these faith healers and all those things actually, and the women, when they have a sexual issue, they have no clue that they have a problem at all. See, 47 of the women are reported not to have an orgasm throughout their marriage. You can imagine, you know that is the status of sex education. And they can't talk about it. Like, it is when you go to a temple, they give prasadam. So whatever you get is your you can't ask more for the god. That's the attitude that people
Yeah.
have towards sex all these days. But I hope
Mhm.
with our today's interaction and communication, people would change, and they will demand for more prasadam according to their needs.
Yes, of course. It is a very important and integral thing to know about because it's just so
Yes.
important to life and it shouldn't be seen as a bad thing. It's a good thing that's just been a little misinterpreted maybe. So,
Yeah, absolutely.
getting into our topic at hand, can you tell us what
Yeah.
exactly is a sexual disorder?
Yes. See, basically, coming to the actual, like, one part of the sexual belief. Okay, belief is one of the most important factor which affects our sexual behavior. So any behavioral changes related to the sexual aspects becomes a sexual disorder. And our biological system is the second part which affects our sexual desire and performance. So the biology and the belief, these are the two major aspects which influence our sexual pleasure seeking behavior. Okay. And the stigma related to the sexual issues will always make you feel guilty, as if you have stolen something from some unknown people. So you would like to hide it, like a scar on your body. Even if after you're married, or I mean, like, you will never come in terms with the sex actually. So that is
Mhm.
that all these socio-cultural beliefs influence a lots on sexual disorders actually. Physiologically, body can have very few diseases. It can all can be correctable. But psychologically, what sex behavior does to the child, and child rearing is most important. Child education related to the sex is most important, and behavior and learning of the parental and child interaction related to the sex is more important. And a peer group is the one major group where you get to know about sexual behaviors. You talk naughtily about sex. Now, of course, a lot of content is available on media, YouTube and Google and all those things, but it has double-edged sword. Like, sometimes you may learn well or you may learn ill. So that is one problem. So coming back to the actual sexual behaviors, so like what happens to
Yeah.
our body when we are planning for a sex, okay? So there is like four phases in the sexual life. One is like appetitive phase where you feel, it's like, take sex as an food, sex, shelter, and hunger. These are the basic needs of the human body, actually. Okay, how you feel thirsty, the exactly way you feel sexual need when you are sexually matured. And the sexual need is for reproduction. Okay, the people have to understand there is a huge misconception about love and sex. Okay, love has got nothing to do with sex, please. All of you got to wake up. Sex is a behavior, actually. Sex is a behavior. Okay, and love is a commitment. There are two different things. Sex is something biological, whereas love is biology plus discipline. you know so do not associate I love my boyfriend so I got to have sex with him. Do not associate like, so if you love me you got to have sex with me. So nothing like that. Okay, so if you want to have sex, you have sex for the sake of sex. Okay, let us bring it to the very basic level of what sex actually means, instead of idealizing sex and like, corrupting it. That's what happens most of the time. We corrupt sex. So when it comes, so all these things affect. Okay, when you come to the appetite phase, consider you're an adult women. Probably your body would say like, oh my god, I'm having a menstrual cycle and I feel slightly changes in my needs and desires. And somehow like all these stupid men starts getting like, attractive to me whenever I'm going through my menstrual cycle. So why is that happening to me? you know why do I have that irresistible desire to talk to this person? The people call it love. And why is that I'm not able to sleep if he doesn't talk to me? Why am I feeling so frustrated if he's not giving attention to me? Like, what the hell is happening to me? Am I in love? Actually, you are attracted to a person in a magnanimous way because your body has decided you are now prepared to have a child. Okay, so you're definitely not going to have a child if there is no bribe is given to you. So the bribe is the pleasure, what we call as an orgasm. Okay, so for that we have an appetitive phase where the sexual interest and desires matter a lot. This is the way a lot of social conflict will arise, and the excitement phase where sexual pleasure, blood flow to our body parts. Erectile dysfunction you would have heard about. Yeah, I want to have sex, but I don't know, my body is not responding. So excitement phase, you can have a problem in that phase. And also orgasm phase, the sexual pleasure peaks and ejaculation occurs. As I mentioned, like many women don't know that they can have orgasms. I mean, you can just ask what orgasm. They feel the process of that pleasure is itself is an orgasm. They don't know there is an ecstatic thing which is going to happen. Like, all the neurochemicals are going to like, like blast inside your brain, and you're going to have a like 440 current of electric jolt, and you're going to like, fall flat. It's actually like a small seizure. It's like a fits. It's like an epileptic episode, which is controlled by you. That's the only difference. And
Yeah.
the resolution phase is when sex is over, so you feel better and you're just relaxed about it. These are the initial phases of the sexual. But sex also has got a gender issues. See, sex is not the same for men are prepared for the totally different purpose, and the women are prepared for the totally different purpose. Nature has no consideration for men. Do you know that? Because one man can impregnate 100 and 1,000 women, but one woman can only have a one child for 1 year. So men are just like wastages. actually. So that is the problem. Hello, am I there online?
Hello? Sorry.
Okay.
Yeah.
Yeah, yeah. So the men realized there is a lot of power within the women, so they made lot of rules for women.
Mm.
So if you are going through on fighting all these struggles, please understand it's not made by the nature. It is made by the men. Okay.
Mm.
So that is the reason why a lot of things happened, and we are still able to figure out and correct those things. And men still give you the freedom as if they are doing some favor to you. In reality, like
Mm.
nature selected women to be the most powerful. Okay.
Mm.
So what happens? Subnormal sexual disorders. Okay, like sexual dysfunctions will happen. Then paraphilias, like beyond that normal sex, whatever happens, and the identity disorder also can influence your sexual behavior. Okay,
Mm.
so let's come into what is the sexual. You can ask me question anytime you want. Okay, you can stop me.
Yeah, of course. Go ahead.
So coming to the sexual dysfunction. Okay, we'll have a
Mm.
sexual function and we'll have a sexual dysfunction. So these medical terms also not, I mean, like, they're not stigmatizing. You can understand, like, dysfunctional family, dysfunctional unit, like, sexual dysfunction. Okay. A sexual dysfunction is characterized by a disturbance in the process that characterizes sexual response cycle. Like, as I mentioned you, there's a desire, then there is a
Mm.
performance, the body changes, then performance and orgasm and resolution. So any of these phases, four phases, we can have a problem. Okay, that's what happens with the sexual disorders. So dysfunction actually. So what are the things like that can influence? Okay, so they are basically categorized into four factors. Number one is sexual desire disorder. No one would
Mm.
ever know. If anybody would ask me like, hello, come on, doctor, how can anybody not desire to have a sex? You know, you're
Mm.
talking rubbish. Like, come on, show me one person show me. Like, they will challenge you. If you say that, I
Mm.
don't feel like having sex. I mean, I don't find like, oh, mujhe andar aati nahi. Like, I don't feel. I have seen
Mm.
so many marital couples got married only because of parental pressures. Sorry,
Mm.
not pleasures. So, so I mean, getting them married is a pleasure for them too. So, pressures and become has become a dysfunctional family unit. Either the
Mhm.
husband is not showing interest towards the women for sex, nor the wife is showing any interest towards the sex. And when you ask them, like they would blankly say, like, "Sir, I don't know, I don't feel it." Okay,
Mhm.
then usually what is the thing everybody just imagine, like if you get married and you say like, look, I'm not feeling the thing. So first thing your husband will think, okay, you have a boyfriend. you know that is the
Yeah.
first conclusion they would arrive at. Actually, okay, there is something fishy is going on. No, I don't know, my
Mhm.
body doesn't respond whatever you do. Please understand, I find it very painful or difficult or I'm not able to compromise with this. So they all do all the possible kind of dramas around it. And your
Mhm.
parents would say like, why, what is your problem, why don't you cooperate? Even if you don't enjoy, even I didn't enjoy, your grandmother didn't enjoy, so what does it matter? You just like, have a child, afterwards you will stop bothering you.
Mhm.
So this is the kind of cultural lineage that we have, where we don't want to discuss about sex, or we don't want to understand about sex. Okay, the
Mhm.
hyposexual desire is a possible reality, and it's a diagnosable thing. Okay,
Mhm.
just like the hypersexual desire. Okay, so desire itself can contribute to the disorder. This is the first phase. Okay, so we would never understand. All people know about erectile dysfunction. That's all. Like, they think sex is all about like premature ejaculation and erectile dysfunction. So this
Mhm.
is about lack of having the desire itself. Okay, it may have a lot of biological reasons, also psychological reasons. See, consider as a child, if you are caught doing some sexual misconduct, how you would have been treated. that influences your adult sexual behavior. If you are humiliated as a
Mhm.
child, or if you are forgiven for the fault which you have done, if they consider it's a fault, or if they have educated you about what to do about it, all these things play a significant role in your adult sexual behavior. If you are being criticized, humiliated, bullied, and made ashamed of, then probably over the period of time, you may start having lack of sexual desire itself. Because desire gets associated with pain. The desire gets associated with discomfort. The desire gets associated with shame. Okay, so once you
It's
get
traumatic.
exactly. So, but after marriage, they'll say, "Abhi to badi ho gayi, ciao, go enjoy your life." Like Adam and Eve, they say, like,
Mhm.
"Abhi, chalo." But it's not so easy because there is no snake
Mhm.
offering you an apple of desire. Okay, chalo, खा लो तू, अपने आप आ जाएगा sexual feelings. It's not possible. So this lack of discomfort is lack of connection in the family about educating children can lead to a hypersexual disorder. And also biological like diabetes can also lead, depression will lead, and anxiety disorders. I mean, like, I have seen people going frigid.
Mhm.
Frigid means the moment the guy touches the girl, girl would become a cadaver. Whatever you do, you just cannot do anything with her. She herself wants to do it. She is like crying inside her brain, like,
Yeah.
I want to do because I love you so much. Like, I want to enjoy it. But her body doesn't cooperate at all. What we call is frigid or vaginismus. You know,
Mhm.
the vagina becomes so
Yeah.
tight the person cannot penetrate at all. So, like, early age of sexual abuse can actually lead to vaginismus. So all these
Mhm.
upbringing plays a significant role, or a childhood plays a significant role in adult sexual disorders. The next is like sexual desire disorder, sorry, desire, and sexual arousal disorder. Sometimes they don't get aroused, whatever is being done. Like, okay, the belly dancing is going on. This fellow will be busy reading whether Trump won or Joe Biden. You know, so it can happen both ways. Both ways. I don't
Yeah.
know, like how women sexual arousal is so patterned with liking. They don't physically get
Mhm.
aroused so much like how
Yeah.
men get sexual stimulus to the body, because women feel like getting
Mhm.
physically seeing somebody and getting aroused is some papa karma and all, like, oh my god, you don't love him but you feel like having sex with him. Oh my god, you must be like, bad child. So the orgasmic disorders, as I
Yeah.
told
That's
you
too
later.
much
So
stigma.
ah, yeah, too much stigma with
Mhm.
that. And sexual pain disorder, sometimes sex may be pleasure for sex is not pleasure for all. It can be pain for some, because of the
Mhm.
biological things, vaginitis and all those things, vaginismus, as I mentioned you, it may become a lot of
Yeah.
painful, lot of pain, which can avoid you to seek sex later. Okay. So what happens in sexual desire disorder includes like hyperactive sexual disorder, where you don't get active, like, desire inside your body itself. Whenever you would like to go,
Mhm.
the body would say like, chalo yaar, ek roti extra खा के सो लो तुम, like, don't venture on these things. So if the guy does it for
Yeah.
2 3 times, if he would feel like very ashamed to meet his girl, and then he may break up, and girl would always feel like, oh, why did you break up? Because I'm not good enough for you. Okay, I'm not good enough
Mhm.
for you, right? So she would make it her own
Mhm.
personal shit later, but it would be the problem with the guy himself. So, like, see, this lack of communication would affect both the parties forever.
Mhm.
It is your first love and guy has got a sexual problems, and imagine how much self trauma you would go through. Like, is he cheating on me? Why is he not doing this to me? Like, there is something going on with him, and what is wrong with me? Please explain. Don't you like my body? Please. Like,
Mhm.
and guy would promptly say, no, yeah, it's not about you. मैं कैसे समझाऊं तुम्हें? Like, how will I make you
Yeah.
understand? But it does happen. It does happen with the girl too. So
Mhm.
guys would bid, okay, तो इसका मतलब है तुम मुझसे सच्ची प्यार नहीं करते हैं, you don't truly love me. We all do
Yeah.
this filmy stuff
Mhm.
for actual medical problems, because we don't know
Yeah.
these do exist. Like,
Yeah,
I
there's
hope
not
like people,
enough awareness about it.
exactly.
So
So I
even if
hope,
your partner tells you that, I'm going through this, you'll say, no, he's making up an excuse. She's just
yes,
saying
true.
that.
Yes, true. Saying
Yeah.
that, and we associate that you don't like me. Mera fear of like abandonment, mera fear of like getting
Yeah.
loud. We mix up a lot of it. So that's what happens in hypersexual and sexual aversion disorder. You know, the
Mhm.
persistently or recurrently extreme aversion to avoidance of all like genital sexual contact with the partner. I too have
Okay.
medical professionals go through this problem. This is more commonly with
Mhm.
women. Somehow uh, they find it extremely difficult even when somebody touches them, you know but they cannot have a
Mhm.
memory. They don't have a memory of sexual abuse or anything like that, but somehow touch is not very comfortable for them. So this is aversion, like not only desire related, it can actually become an aversion.
Mhm.
Okay. So what happens in arousal disorder? How do I understand, doctor, I have arousal disorder? The most important thing
Yeah.
is like your body is not responding. So there is no vaginal lubrication, or for a guy there is no maintenance of erection.
Okay.
So there is no proper arousal. So the orgasmic disorder, female orgasmic disorder, like absence of orgasms, okay, for a female, or a premature ejaculation for a guy, or a difficulty in ejaculation, what we call like delayed or no
Okay.
ejaculation at all. Okay. So the sexual pain disorder. Okay, what happens in the pain disorder?
Mhm.
Like dyspareunia, what we call that recurrent pain during the intercourse. That can also
Yeah.
stop you from going for. You can smile. It's okay if your dog is like remembering you. Everything works. So now anyway everybody keeps pets. So cool. So involuntary spasm of the outer third of the vagina, as I mentioned in vaginismus, because the pain is so intense that it is something like
Mhm.
consider your throat is you got a cold and your throat is swollen up inside. When you try to swallow a
Yeah.
food, what would happen? The difficulty, the pain you get in the throat. So you would avoid at any cost and you would go for a liquid diet or something like that, right? So same
Mhm.
thing happens with vagina also. Whatever it is, it cannot
Okay.
take anything inside because it's so painful for it. Okay. I mean, like, because unless people are experienced, they don't understand, because you cannot have an empathy for these kind of things. So what
Mhm.
I do the pain, like, in your real life, what would probably would have happened to you. So I think everyone would have gone through a throat pain, you know, as
Yeah.
a tonsillitis, everybody would have had a tonsillitis. So exactly that pain is more than that, million times more than that is what is being experienced there, because the mucosas are all same, it's very sensitive to the pain.
Mhm.
So
So is
what
this
could be
more
the
common at a certain age for women, or can it occur at any age?
it is one is hygiene. Okay, if you are not
Mhm.
properly hygienic, then probably it may vaginitis can cause infection of the vagina, can cause this urethra, like urethritis can cause this one, number one.
Mhm.
Number two, if you're like subjected, for anybody is subjected as a child, sexual abuse, then your brain will associate that to the pain, so it is something
Mhm.
like you touch a fire, so you're not going to touch fire again because it's going to hurt.
Yeah.
But there, you are not actually being aware at all. It can be pleasurable for you in the future. Okay, but the
Mhm.
brain cannot recognize the differences. Brain just says like, look, it's painful for you, so I'm going to save you from that.
Mhm. Yeah.
Brain will be working in protection. Brain will be working to take care of you. But the tragedy is that it cannot do that. Okay. Then repressed regression emotions, as I told you, like men and women, all the gender bias stuffs will also fear of performance, anger, no private place. India, it's like no private place. Like where should we live?
Yeah.
Like before somebody knocks the door, okay, premature ejaculation. Like that guy wouldn't even know, like it's happening, because like before somebody comes I should come. The brain is planned like that.
Yeah.
So sometimes they'll be subjected for insult also, like yeah, yeah. So
Mm.
okay, so always be considerate to your sexual mate whenever they're not performing well.
Mm.
It is your job to reassure them. Don't be like
Mhm.
belittle them and insult or humiliate them, because later they will make it into some issue and obviously relation they're gonna break up. Okay, so
Yeah.
sexual
And
trauma,
the
childhood abuse. Yeah, tell me.
and the anxiety also kind of builds up around that. So the more you say, "Oh, I'm, I'm not able to orgasm," the more you think about it, the more difficult it becomes.
I have
So it's
actually the people will what we call like first night syndrome. You know, the
personal.
guys would first night syndrome. It is actually diagnosable. The guys get so like anxious about the whole performance. We call
Mhm.
that a performance anxiety. Can you believe that? Like we'll say like boss, there is no spectators for you. Okay, you're on a stage to
Yeah.
sing. Okay, it's logical that you have a performance anxiety, but you're going to stay with this female for like years and years. Like, why would you? But that for every guy, has got this stigma. Like, because next day friends will ask, "Bhai, kitne bar kiya?" Like, now they
Yeah.
got to tell them like, oh, bar hua ya na hua. Like, in that case, like, good friends or some closer friends, like they would actually share and they say like, yeah, it's okay, no problem. I know a person, you can contact
Mhm.
them. अरे होता है यार 2-3 बार इसमें कुछ प्रॉब्लम नहीं है आराम से like you can do it. Or
Yeah.
there are liars who come and brag मैंने 10 बार किया.
Yeah.
So when somebody comes and say like I did it for that time, I did it for this time, I would like so many hours, 10 times, 20 times, like either that guy is telling a lie or that guy has a psychiatric problem, you know. Because
Yeah.
if you're hungry, how much do you eat actually, like how much or your appetite allows you to eat, so appetite
Mhm.
cannot be the same for all. So it is not a competition. See, it is not a Olympic championship where like चलो मुझे perform करना है, gold medal जीतना है. It is nothing like that.
Mhm.
You got to think like it is like taking a bath, it is like taking a massage. Like, you enjoy it. The more you enjoy it,
Yeah.
you'll be able to help the other person enjoy it. you know if you are gone to a
Mm.
massage therapist and every time he touches you because oh, like it's like, okay sir, sorry sir, sorry sir, like neither she enjoys doing the massage. So
Yeah.
you focus on yourself and be happy on that. Okay, and it's
Mm.
okay, everything is okay. And says, if you have a premature ejaculation, well and good. If you don't reach orgasm, well and good. Be compassionate towards
Mm.
yourself. People will do well. Anyway, I will suggest treatment for that. So these are things. And anybody who is
Yeah.
on drugs, psychiatric drugs, they also have a
Mhm.
sexual problem. Our SSRIs are very like, so for the treatment what we give for depression. Most of the time, the person will become happy
Yeah.
and he'll come back and say, "Sir, I'm not able to have an ejaculation." So it causes like that is the major complications that we get, side effect we get. So please talk to your
Mm.
doctor if you have anything like that. Don't shy away and
Yep.
help yourself. And anxiety. So, what is the treatment for these basic things? The
Mhm.
preliminary जो भी होता है. One is anxiety reduction, as you mentioned, and education, skills and communication training. Okay, communication. Do you know communication is one of the cornerstone for sexual happiness?
Mm.
You cannot actually have a sexual relationship without an appropriate communication. You know? So that is
Yep.
the most focus on that, like that is the most important thing, building yourself. And
Mhm.
this is about basic sexual behaviors and problems that people would get. So if you have any doubts, you can ask me about it. How many minutes we are left, Naveen? I think we have covered 20
We
minutes.
still have,
Okay.
yeah, we still have time. So, what I found interesting about what you said is like, how we have corrupted this idea of sex. And so with a lot of, those misrepresentations and things that the media has shown us, that's how we get these, unrealistic ideas. So part of that is the porn industry. So I wanted to ask you, what kind of ill effects can, watching these kind of
Mhm.
videos have on an individual?
Okay. Now you are settled in Hyderabad, no?
Yeah, I'm in Goa.
Oh, you're in Goa. Okay, fine. I don't know how. If you are see, do you watch Telugu movies?
Maybe I've seen like a short film
Okay,
here
Hindi
or
movies
there.
also.
Yeah.
Singham.
Sorry.
Did you watch Singham? Singham.
No, but I've heard of it. But
Okay,
you will
okay. No,
continue.
it's
Yeah.
I'm just giving you an example, like how like movies, whether it is a porn movie or a general movie, okay, whatever we
Mhm.
watch. So in the movie, what they do, they exaggerate things. Okay,
Mhm.
exaggeration is very essential in the movie to make an impact. Okay, hero is shown as a superhero. So it's the same with the porn movies also. Hero is seen as a superhero.
Mhm.
And tragedy of women in that porn movies is their her only desire is to please a man.
Mhm.
See, it becomes a huge problem in the gender identification of the sexual needs. Okay, so like guy will have 10, 15 girls, and his job is to take all of them, and the stupid people of our country would also believe, I mean, like sexually stupid, otherwise intelligent. Okay, so they would believe that it's actually possible. you know it would have been shot in 100 it's not a movie done in one day, like how any other movies are done.
Mhm.
Porn is also done like that. So everybody has to realize that there is a take retake. Okay, and
Mhm.
there is an edit, and everything compiled, whatever the best shot they get, they'll compile it and give it to you for a 5 minutes or 10 minutes or 30 minutes, whatever time it is, and you would see it and be
Mhm.
mesmerized, like, अरे यार मुझसे क्यों नहीं हो रहा है, you know or a girl would
Mhm.
see it and feel like, अरे तू ऐसे करते क्यों नहीं हो. That is actually
Yeah.
porn is something for personal use. You use it, you watch it, you enjoy, and don't try to become a superhero. Number one. Number two,
Mhm.
size of the penis is the lot of patience. Every day I get patience. Sir, mera chota hai, mera chota
Mhm.
hai. So usually I keep like making jokes. क्या तुमको झूला झूलाना है क्या, do you want to make some hanging garden or what, attach it to somebody. I literally tell them, nahi sir, bahut chota hai. Then see, everybody has to understand the vagina is 3 to 4 inches more sensitive.
Mhm.
Okay, so if your penis is more than 4 inches, it's good enough. And the
Mhm.
purpose of the penis is not to satisfy the psychological belief of the women. The purpose of the penis is to reproduce. Okay. So vagina and penis are given to you reproduce, because you people are so utterly selfish. You wouldn't have done it if there was no pleasure in it. So body designed. Imagine if sex was not pleasureful, how many would go for a children?
Yeah.
Neither you would have been here nor I would have been here. All the money they would have enjoyed on their own, making whatever makes them
Mhm.
happy, and they would have died. And like I don't know how we would have, I mean, like Earth would have, just like dinosaurs, humans would have ended by now. So
Possibly.
because of that pleasure, the misinterpretation of the pleasure is, so one, we have to understand
Mhm.
main core theme for sex is like biological reproduction. So it's only humans use it for pleasure, and it's only humans who can have sex 365 days. No other animal has this ability. And in that, we still
Mhm.
want to manipulate it. We want to make it more. Every animal has
Yeah.
a season. Every animal has a season. So let's be considerate towards yourself. And obsessive use of porn is always harmful, because it comes under the addictive disorder. You know, and if
Mhm.
you are making porn as a primary pleasure for your life, so many times in marriage, sex is lost because husband watches a lot of porn, and he's
Mhm.
addicted to masturbation. And so many times it happens with the girls also. They are addicted to masturbation. So by the time husband comes home, she's already tired. Okay, so husband will ask like, aaj kare? Like she won't say I masturbated. Okay, she just say like, no, yaar, not today. We'll do tomorrow. You know. So, but she don't tell. So there is a guy always feels rejection. Sometimes they go into suspicion. See, a lot of drama happens. So if you are masturbating, tell your husband. Okay, I masturbated, or a boyfriend, like so I'm not having sexual desire for now. Then what is next? Actually, then how do we do? Then couples can join together to masturbate. Okay, so one can help each other to masturbate. So instead of doing it in advance before you meet your boyfriend or a girlfriend, so use that. Please do not get into this illusion of like sex means you have to only have intercourse. Okay, hugging, cuddling, kissing, being passionate, being nakedly staying together, and see, there is a treatment for premature ejaculation. You know what is the treatment for premature ejaculation? Do everything but don't have penetration. So many
Oh.
times the guys will come, sir. Now I'm having penetration, and you're telling me not to have sex because his problem is associated with penetration and premature. The moment he thinks of penetration, he's going to have a premature ejaculation. So we teach them sensate focus, sensate organ, like you got to focus on the sensate organs and please each other. And if you're not able to satisfy your partner on vaginal intercourse, you don't have to feel guilty about it. You can satisfy her through so many other means which can be chosen. It's only the industry, the porn industry, which makes you feel vaginal sex is the only sex. Okay, as a matter of fact, clitoral orgasms are more powerful compared to the vaginal orgasms. Okay, so people can actually have an idea, like they can couple can sit and read together and find out like hum kya kare. Like when you want to buy a car, what do? All sit and discuss. But when you're not having an orgasm with each other, what do? You abuse. You know, तुमसे नहीं हो रहा है, उससे नहीं हो रहा, ये नहीं कर रहा, ये नहीं कर रहा, like मेरा जिंदगी बर्बाद हो गया तुझे मैं शादी करके. Like everything, we would do everything and we would say everything. Okay, so like that it happens. Like we have to understand and just sit on the bed and talk about it. It's okay. And girls should pamper about. Both should pamper about body, because see, you're born with the idea of being told you are not good enough. You're short, you're fat, you're dusky, you're fair, you're too. Like fair girl, yeah, too white cockroach. You're if you're dusky, like like, oh, you should have been little fairer. Oh my God, you should have been little fairer, my darling. So there is families are never satisfied because they're unhappy souls. Their parents found faults in them. They will find faults in you. So don't fall for that. Okay. Develop a self-esteem through looking at yourself in the mirror and complimenting your own body. This I suggest for everybody. Look in the mirror. Take a time. Not only your face. Everything belongs to you. Do you know we act as if below neck is not ours?
It's true.
Have you ever thanked your legs? Thank bro. Like I'm because of you. Like I'm able to walk around everywhere. We take it for granted. You know, hands. Imagine what would happen if you just spend a day tying your hands behind your back. You will know whether you want sex or hands. You know.
It's so true.
So yeah,
Yeah.
we are so ignorant about these things. So we should focus on loving every part of our body and flaunt it in front of the mirror. Appreciate it. Talk to your body. Just tell, wow, I just love my breast. Oh my God, I'm so fat. I'm infatuated with my body. Like, it,
Yeah.
unless you fall in love with your body, don't expect anybody to fall in love with your body. As simple as that for guys and girls. So if you look at your penis and say like, oh my God, it's so small, nobody's going to love me. So obviously they're not going to love you because you already made decision. So now you got a girlfriend, she'll say like, no, yeah, yours is the biggest I have ever dated. So like, no, you're telling me lies. They do say
Mhm.
it, they say like, no, you're telling me lies, I don't believe you. So now
Mhm.
how do you make him believe, or how do you make this girl believe when she'll come back and say like, hey, I don't you think I'm looking little fat today?
Mhm.
Then he will say like, I find you attractive. Then I have seen people right open say like liar.
Yeah. It's
It is
difficult to
not
believe somebody else if you don't think so
believe
yourself.
in yourself. Yeah, exactly. So
Mm.
spend an exercise every day or whenever you take bath to appreciate your body, talk to your body parts, say that you're thankful
Mhm.
that they are there the way they are. You know, if you don't like something about, work for it. Okay, just don't sit and creep for it. Okay, just like "So, मेरा belly ज़्यादा है तो मैं क्या करूं?" Love it as long as you lose it. So that's the only thing you got to adopt, love your body. Because see, in our culture, they don't teach you to love your body. Considering that as a child, if you are feeling your breast, I mean, like people probably come and hit you. You're in Goa, okay, so maybe different culture,
Yeah.
but other places it would be different. Okay,
Mm.
so it's very difficult. It's very, very difficult. Okay. So I always suggest people to love your body. Okay. So the way you love your come on, like if somebody comes and tells you, "Wow, and what eyes you have, man," like you say, like, "Oh, thanks, dear." If somebody comes and says, like, "Wow, what a breast," so like, "Hello, mind your language," you know.
Yeah.
So it's always, I mean, like somehow we have made whole community into a stereotypic, like legal issue when it comes to the body. We are like
Mm.
we ourselves are IPC section, okay, running on our body. There should be some lenience and there should be consent actually. See, if the person takes a consent from you, hey, can I talk about your body? And please stop me whenever you feel discomfort. And if the girl says
Mm.
okay, so it is not without a consent.
Yeah,
Somebody
of
cannot
course.
come and bulldozer you saying that no, yes, I say. Like those who are listening, please take a consent. you know don't take
Yeah.
the liberty, because consent and contract and openness, these are the three things which will hold up a relationship forever. Okay. So now coming to the paraphilias. So we spoke about
Yeah.
normal sexual things. So what are paraphilias? Include fetishism, like
Yeah.
being exhibitionism. It's more common in India.
Mm.
You would have seen like while driving somebody's roadside. Frotteurism, like most common. Frotteurism, like people find you in the bus and they'll start rubbing you, or you're going to the musical
Mm.
concert and there will be a guy standing behind you and rubbing you. Like it happens to women more than men, and would be more happy to get rubbed, but nobody does that. So so it's like I mean, you have to recognize it's a psychiatric illness. Instead of shaming the person, you could say like, boss, you're ill, you're a sick fellow, please go take help. Okay. सो हमारा इंडिया में क्या करते हैं, सब लोग जाके उसको मारते हैं, लेकिन पकड़ो मारो, like they ashame him actually, like they ashame her. See, even if you're caught in some sexual act, you're not scared of your family actually, you're scared of getting ashamed. you know
Mm.
as long as country runs about basic needs on a shame philosophy, okay, so we will never attain that happiness or health related to that aspect. Then pedophilia, every child abuse, 70% of the child abuse happens from the family members. How many people talk about it? Nobody talks about it. They'll say like, I actually I have people like, whom I am very close to. I mean, they don't accept even if they speak about it. Like my
Mm.
uncle did this to me. Nobody would say like, don't tell anybody. So what are you
Mm.
actually teaching the child to whole life? You get sexually abused and don't tell anybody. It's
Mm.
not as protecting the family. It's like whole she's going to tell her daughter, she's going to tell her daughter. So it's a
Mm.
genetic illness which you're transforming by saying one simple thing, don't tell anybody. Okay.
Mm.
So pedophilia is a big disorder. So it is a non-bailable crime. Do you know that? It's a non-bailable crime. So if anybody comes across these things, one should take it very seriously and consider the health of the child, not protect the sickness of the man. Okay, so that should be taken into consideration. Transvestism, like now it is after Ranveer Kapoor, transvestism has become a fashion. So in transvestism, we have two types. One is just using clothes, female clothes. Another one is feeling gratified by using female clothes. Like I'll be able to have sexual pleasure only when I wear a female dress. That's a disorder. Okay. Boyfriend, girlfriend changing clothes is not a disorder. Then sexual sadism. Okay. Now, I mean, who doesn't know about 50 Shades of the Grey? Correct.
Yeah.
So it teaches about the sadism actually, and how bonding and contract and all those things. As long as it's in those BDSM contract trains, that's all normal. And the masochism, like, masochism is like where you would like to be sexually hurt. You feel like hurt is going to make you feel attain a sexual pleasure. Getting whipped or beaten or hypoxic things. So we do not actually put all of them into a disorder category right now. It depends. Like if that only becomes your primary source for pleasure. See, in what happens in 50 Shades of the Grey, if you've seen, that guy cannot have a normal sex. So the girl has to leave him and go. So if he can have a normal sex and occasionally practice BDSM, then probably they would have married. So that is where the disorder comes in. Okay. So voyeurism, like now voyeurism has been like so low because when we were school kids, like people would try to see like, oh, chalo udhar dekh raha hai, idhar kya dekh raha hai? Oh, I mean, it would have been a big thing. But now, like, you have a sex in your hand, so it doesn't matter actually. Voyeurist. So coming exhibitionism is like when, like, okay, I show off my body, so am I an exhibist? No. You show off your body and you get sexual pleasure and you get an orgasm. That is exhibitionism. Okay, so you should know the
Oh,
difference. But
okay.
yeah. So it is not just showing off the body. That is not exhibitionism. Okay, so you have to get, but the primary source of sexual gratification by showing off the body. So that becomes a disorder. Okay, fetish is like feet fetish. More liked by so many girls these days. Okay, so some object like clothes fetish, feet fetish, they'll get obsessed with that. All you have to understand one thing, Achana, is like here, if you avoid normal sexual intercourse and you choose all these things as a primary behavior, then only these things are disorders. Okay, otherwise they are
Okay.
not disorders. So tourism, as I said, like people keep on going from buses to buses and public transport or parties and anywhere just to touch a girl. So that is also a sexual disorder if they cannot have pedophilia, as I spoke to you. That is also a sexual disorder, and it's a serious offense. Like all other things are okay. They also fall into the offense category, but pedophilia, child sexual abuse is the biggest crime. Okay, so sexual masochism, it's as I told you, it's about the consent. If there is a consent is available, fantasies. There are like fantasies involved about getting forced for a sexual. I mean, like every girl is being said to have one fantasy like that to be forced. Of course, it's kind of a rebellion thing, I guess,
Okay.
and that surrender. I'd like
Yeah.
to surrender. So sexual masochism and masochist and sadist, they make a companion. Okay. So see if any see that is actually recently I saw one Telugu movie. Okay. In that, the mother of the girl asks a guy for a medical records, not like kundalinis and jatkas and all those things. So she asks for a medical records. Give me medical records of your son, then I'll see. Okay, so that should be the culture we should adopt in the future. you know,
Mm.
because I have patients who have not had sex 4 years after marriage. Actually, it is possible. It's very much possible because the guy was so habituated to go to like professional sex workers, and they would scream his name when they have sex, and his wife was not doing that, so he never
Yeah.
attained sexual pleasure, and later after that he never had sex with her. You know, these are all big issues, but it's not like recognized.
Mm. So,
And
doctor,
yeah,
we have a few
tell me.
questions from our viewers.
Good.
Um, one of them is, how can sex education in India be made comprehensive?
Sex education be in India made comprehensive? Like, I think this is the media now. Like, we have to
Yeah.
interact, and educate the youths maximum, because we do not have any government system to do that. Number one, and
Mm.
parents are not at all willing to do that. Okay. See, I have a teenage daughter, 13 years. So I told her, like, today I'm going to talk about sex uh, in the forum. So like that, like
Mhm.
you introduce your children. Sex is not just intercourse. There is a lot of things related to the sex, and tell them over the period of time, you are not a gift of the god, you're outcome of sex. you know
Yeah, it needs to be
so
normalized a little.
I know it's so normalized.
I
So
get what
like
you're
that,
talking
we have to keep, like, peer groups, set up a peer group, set up a healthy like like channels like yours, which is working hard to educate people on mental
about.
health. So you should engage a
Mhm.
lot of people on that, and invite people like me again and again, and like educate the mass.
Of course,
Yeah. So, like, I mean, this
this
is the
is a
only
big
way.
topic and there's so much
Yeah,
to cover.
this is the only way, actually,
Hmm.
because otherwise,
Yeah.
see, as I told you, bill was already presented in the government, and they have not accepted it right now. So it is in the government.
Yeah.
It's in the government
Hmm.
from 8th standard to 10th standard. Somehow, probably hope in the future, government will think rationally about it and make sex education as a part. And see, teachers don't have to feel guilty. They can engage teachers. Like, I can go and teach in 10 schools. I'm very happy to teach. I love
Yeah.
teaching. So they can invite professionals and
Hmm.
teach. So like that, schools also refuse because they don't know what to do about it. Everything can be done and taken care
Hmm.
only if you have that willingness to do it. So right now, other than government, this is the way that we have to keep on educating, keep on reading healthy things about sex.
Yeah. So we have another question more related to mental health.
Okay.
Can you speak a little bit about sexual misbehavior in dementia and OCD?
Okay, very nice question. Very nice question. See, that was my, like, next, all these things, how the psychiatric can influence these behaviors. Talking about OCD, okay, obsessive compulsive disorder, sometimes it may present itself as an hypersexual disorder, compulsive masturbation, or guilt related to the sex, considering it as a dirty. So I have a lot of patients who have cleaning OCD and who do not allow their partner to have a sex with them, and it's a big fight at home every day. Okay.
Mhm.
And compulsive masturbation was always misunderstood, and the guy thinks like he's sexually very horny, the girl thinks like she's very horny sexually, like, I can't be satisfied, kind of a thing, macho. But
Yeah.
compulsivity, like where anything comes to your mind as a priority for more than 1 hour a day, okay,
Mhm.
uh, then it becomes a disorder, obsessive disorder. So obsessive disorder can be a thought process, or it can be a act, behavior process. In the thought, it can be blasphemous thoughts also. You get thoughts about sexual, about God and your mother and sister and
Mhm.
everybody, and you get so fed up with sexual thing, and you want to kill yourself, you want to feel bad about, guilt is going through thing, like, you get their naked images of your parents and all those things. So you
Mhm.
have to realize it's not a sexual disorder, it's a OCD. So you have to
Yeah.
get yourself cured. No need to feel guilty about it. Dementia, frontal lobe is totally gone. Frontal lobe is the one which is helps in our executive function, like which allows us to maintain the social norms and regulations, and it is connected to the amygdala. Like amygdala is where we get all our hippocampus, amygdala. These are the things which are related to the emotion, rage, and sex. So our frontal lobes keeps telling the amygdala, boss, you're in a social circumstances, cool down. Okay. So when you get drunk now, that will go away. Now you know
Yeah.
actually what happens. So that is one thing. So it's a nice question actually. So dementia, what do
Yeah.
we do? We cannot actually blame them, because most of the time they come and complain like, father-in-law is hugging the daughter-in-law. Okay.
Mm.
So it's like, oh my God, aisa kaisa ho sakta hai, Pitaji? Like, the drama starts. So you have
Mm.
to understand he may be having a dementia and you cannot
Yeah.
control. It is not that sexual desire with intelligence they get. It's like
Mm.
animalistic behavior, just like an animal. They may not have even have an erection also. Okay, but that, I mean, just like a child, how child would go and touch every woman's boob, not only a mother's boob,
Yeah.
so
Yeah.
you don't see it as a sex. Okay, you see it as something else. So it is same thing with dementia. So because
Mm.
the our brain has actually compromised, so we have to put them on medication and help. OCD also same, like we have to put them on medication help. No amount of therapies are probably helpful, because these two have biological changes in the brain. It is
Yeah.
something like if I fall down and if I have a scar, so how the scar will remain forever. There is an aberration. So like that, dementia and OCD will have the scar in the brain, to make it
Okay.
easily understandable.
Yeah.
So do not tell people like, hey, take control, have a willpower. Like, how can you not control your
Mm-hmm.
thoughts? Don't get into those kind of things. You need to be helped. You need to be helped, whoever it is. So that's a nice question. So any other questions?
We have a question about pregnancy and sexual disorders. So, can sexual disorders impact conceiving?
See, pregnancy and sexual disorder, India is the hopeless, because in India, the moment you get pregnant, they say like don't have sex. God only knows why. Whereas in America, they tell have sex till the last month, because that's the only way you can have an easy delivery.
Oh,
Yeah, yeah. Here
yeah.
you get pregnant, you are done. You and your husband both are done. But next, you don't even know whether you're gonna reconnect later or not. So nothing like that. You can have sex. You can save sex. Just practice safe things. There are like certain positions which are prescribed to indulge. Not everything you can do. You know, when you get pregnant.
Mhm.
And first 3 months, probably you can be a little cautious. After that, I think it's okay, normal to have a normal sex. Don't worry until the delivery time,
Mhm.
because it also, what it will do. It will also actually make a woman's body acceptable. You know, you have that
Mhm.
belly and all those things, and
That's
you have
true.
so it is such a loving moment, and it's woman doesn't have to be shy about it. So please practice sex, safe sex. That's all. So it is normal to do it. And post the pregnancy
So,
delivery sometimes, yeah.
no, go on.
Okay. So post delivery, sometimes we have postpartum depression. Sometimes mood disorder will come for 10 to
Mhm.
20% of women. So that may affect the intimacy. There all depressive signs and symptoms will be there. So that is the period probably you should avoid having sex. And you should be put on medications and taken care. Once you become better, again you can have sex. So please get rid of all the taboo associated with pregnancy, precious, and don't run here, don't run there, don't touch that, don't go down, go up down. More active you are, normal delivery you will have. In India, we have a
Yeah.
lot of cesareans just because you are made to sit at one place and eat like a what you call glutton. So you can change that.
Yeah, definitely. So before we wind up this session for today, doctor, is there anything particular you would like to impart to our viewers?
I would like to say is like any sexual related issues, please do consult an expert. Do not fall prey for these all
Mhm,
media things and other things. And there are a lot of fake people who are available who charge you. How to identify a fake doctor? He will ask for an exorbitant price. You know, very simple.
mhm,
I'll courier you this powder. You take it. Give me 30,000. Stay away from him. You can get okay with
mhm,
300 rupees. So identify that and openly talk to your friends, even if they make fun of you, doesn't matter, because among 10 people there will be one person who would empathize with you and want to talk to you about it and love your body. And we are actually, like, there are a lot of therapeutic things which we didn't discuss today. There is a penile correction, like, if
mhm,
you want a penis to be made long, it can be made long. There is a treatment for it. The muscle from your thighs and back can be taken and put in. So it's a surgical correction which is available in India, and there are a lot of elderly people go for it. Okay, so
mhm,
it is also available. And of course, now breast implant is the most common thing. There should not be any guilt related to that. If somebody wants to go for an enhancement, you can go for it. But the size of the breast is should never become an issue. Okay,
mhm,
so body, like, it is not like how the girls would prefer. Like, it's the same, like, long big pennies and big boobs. It's like, it's a myth
mhm,
actually. If the rapport is wonderful, loving, caring relationship is wonderful, it can be taken care. And premature ejaculation, erectile dysfunction, all of them have a pharmacological treatment. Means treatment is
mhm.
available. Find the nearest psychiatrist around your place, and they'll be of good help to you. Okay. And anything, okay, DM me or DM Antenna. So we'll see what we
Yeah.
can do about it.
Okay. Thank you so much, Doctor, for coming on board, enlightening us, and teaching us to love ourselves, to accept sex as something that's natural and beautiful and more about passion than anything else. So, and especially thank you to all of our viewers for signing in. I hope you guys enjoyed this session, and maybe we can get Dr. Lokesh with us again soon to talk about more things. Okay, so this is Anthea signing off. Please like, comment, and subscribe.